state officials clearly don't view you as low-income family.
Yeah, they don't.
Do you feel like you are?
Of course. Probably below low income, below the low income mark, So it's just ridiculous that we have a copayment. I don't think it's fair, because we really do need the medical coverage and we really do need it to be free.
Do you view this as an issue of equality in some way?
I don't know. I just think that they don't have their cost of living up to date.
State officials.
Yeah, I don't know about if it's, equality or anything, but I just know that they are not up to date with the numbers, and what's needed. And they don't really give you too much allowance for other things, and they take your gross income, you know. It's just like, well, what am I supposed to do?
And did the co-pays ever stop you from getting care for any of the children?
Yeah, there were times that we thought, we might have needed to take one of our children to the doctor, but we weren't sure, because when we get our notice from Medi-Cal, then it says you have a share of cost of, it was like about $2,000. So we were like, we don't have $2,000, so, maybe this time we can just skip, maybe it'll just pass or something.
As a parent, how do you feel when you're in that circumstance?
I don't like it, of course, because who knows, fortunately it was just, a little, I guess, a 24-hour type of thing, but, it could have turned out to be something more, and then who knows.
In general, how worrisome is it to you that you don't have health insurance coverage that's free, that something may come out of the blue? How much time do you spend thinking about this?
A lot, because, like, for example, we, like I said, we had the co-payment for like $2,000, and my husband, he rarely goes to the doctors, unless it's like really, something really bad. And there was a time that he didn't go when he actually felt like he wanted to go because of that co-payment. And it's just like, that's not fair, because he doesn't really go. And when he does, then is he going to have to pay $2,000, or, what is he going to have to pay?
Are the kinds of things we're talking about things that other family members experience, or are they
Yeah,
in different...
my mom is the same thing, because she has high blood pressure too. And, she needs also her thyroid medicine and things like that. And same thing, she has a share of costs with Medi-Cal. And, her income is not high at all. And it's just ridiculous that she has to pay, like hundreds of dollars for her prescriptions. And she really needs those prescriptions. So,
have you ever shopped around for private health insurance?
Not really. Sometimes we get things in the mail, that shows that we can get, health care for like $53 a month. But then when you call, and you say, oh, I have more family, and this and that, and then they just boot it up really high too. It's just still not worth it.
Obviously, we're here to talk to you about health insurance, but are there other parts of your monthly budget that you worry about as much as you do about the potential medical bills and the medical bills that you do have?
Yeah. We had a set budget for gas, but since the gas is going up, then something else has to go, we have to, budget something else lower, a lower amount. So gas and health insurance are kind of on the same level, because they fluctuate so much. I mean, things like our rent or our cell phones, they stay the same.
That's predictable.
Yeah. So gas and health insurance, those are the two unpredictable, amounts.
Okay. Tell me a bit about your family budget. Is there anything left over at the end of the month? Do you budget for any medical expenses in the course of a month?
No, there's nothing left over, and we don't budget for medical expenses. We have to, it's just bare minimum bills only, basically gas and food and, things like that, and daycare.
So that if a medical expense does come your way, that automatically means you're in debt for the month.
Yeah.
How many months out of 12 months does that happen?
A medical expense? Probably, I would say every 3 months, because, my younger children, they have to get their, vaccinations and things like that, or different checkups, well baby checkups and things like that. So I would say like minimum of 3 months, every three months.
And when you do accumulate some debt from medical bills, does it go on a credit card?
No, we just kind of have to say, can we pay it down? Or sometimes, like, depending on what hospital we might have went to, they have they might wipe it out if you show them, oh, I only have, this much money for, this month, and I can't afford this.
When you look for a job, Japera, how important is it for you to try to find a job that gives you health insurance?
Well, it would be nice, to have, a job that has health insurance for the whole family, but it won't take away my whole check, because then I'll just be working for health insurance. And so, that kind of defeats the whole purpose of working.
As we speak, you're about a month away from moving from a temp job to a job with San Mateo County here in California. What benefits does it come with?
I will get medical, dental, vision, and a flexible spending account.
Are you excited?
Yeah. If it doesn't, like I said, if it doesn't take away my whole paycheck, to cover me and my whole family. So we have to look into all the different plans and decide which one we're going to.
Have you run the numbers yet?
No, not yet. We will get the full, extended version of, how much it will cost, and, the different choices when I start my orientation on the first day.
You know what you're going to be earning per hour. Have you figured out yet, with that salary, how much you could afford to have deducted for your premiums?
No, I haven't done that. I've just been figuring out all my other bills. I haven't even thought about the premiums for the health insurance.
Do you have any concerns that it's going to take too big a chunk?
Yeah, I do. I do, because we have 5 people. If it was, me, myself, I might just be covered without too, maybe they might take $50 a month or so. But I think, like, for a family, I'm thinking it might be about $200, and I don't know.
Could you manage that?
I'm not sure. I don't think so.
When we first spoke to you a couple of months ago, you were asked one word to describe your feelings about all of this, and the word that you chose was overwhelmed.
Yeah.
How would you describe yourself today?
It's the same. It's the same. Yeah, because it's just like, can I just go to the doctor? Can I just take my kids for their checkups? Can I just get my prescription and, without worrying about all of this, like, am I covered? Am I going to have to pay? And can I afford it to pay? And, things like that.
Have there ever been tears?
Yeah, when I couldn't take my kids. Or like when we got to the doctor for a checkup and they were like, "You don't have any insurance." And they're like, once again, $65. You know, the procedure might not have cost $65, but you have to pay a minimum of $65 just to get in to the door to see the doctor, you know. So it's just like, you know, I just have to try to find some kind of free clinic or something.
Who do you blame for all this? Is there an institution, a person?
Well, whoever, whoever sets the the cost of living, or I don't know what it's called, like the range of incomes and things like that, then whoever does that, they don't know what they're doing. That's who I blame. I don't know who does it, but it's not right.